Hey everyone, welcome to another edition of the CHP Spotlight Interview Series. Today, we are very blessed to have Dr. Garry Ho with us. Dr. Ho, he's been working with us for a little while now, and we've crossed paths through patients in both our McLean, our Bethesda facility, and he's taking great care of our people. And so I decided, I was like, you know what? We got to talk to him. I think a lot of people have questions that he can maybe answer better than me. So, for anybody wondering, Dr. Ho, he's a sports medicine specialist with Ortho Virginia. And one of the things I loved that when I first found you, Garry, is when I looked you up on the website, you said that you look at anyone with a body as an athlete, whether
Yes,
they're, past, current, potential athlete, whatever the case may be. So. That's a little bit of a Dr. Ho, and then Garry, thank you so much for joining us today.
thanks for having me. This is fun. I love
Uh,
working with you.
Absolutely, thank you for that. And so, for anybody watching this, right, I might know this answer a little bit, but tell us a little bit about what you do, what types of conditions you treat, and what types of people that you work with.
Absolutely. Thanks for that. So I'm a sports medicine physician. I'm what they call a non-operative sports medicine physician. So I do a lot of procedures, but non-surgical procedures. But I also do a lot of counseling and coordination of therapy and a lot of education. But in the sports medicine world, it's an interesting kind of overlap between other specialties. But we treat patients from all walks of life with different musculoskeletal complaints, different neuromuscular complaints, basically things that are physically preventing them from living their fullest life. And so we help address that. As far as the type of conditions I see, people often ask me, like, maybe I've treated their shoulder or their hip, and they'll say, "Do you do knees? Do you do?" Yeah, I treat head to toe as a sports medicine physician. I actually enjoy all of it. And I kind of think of myself and always like trying to find a way for me to plug in and how I can be helpful. And what I've done over the years is try to build my repertoire of tools so that I can be a bit of a Swiss Army knife. When it comes to use that analogy, so I can plug in a lot of different ways to help people. Having been at Ortho Virginia now for a little bit, love being here. I've been kind of exploring how I can best help the rest of the team. And again, using that analogy, using different tools in my Swiss Army knife of tools to see where I can help out the rest of the team. And as such, I've started to see some patterns emerge in the types of patients I'm seeing here. I see a lot of frozen shoulders, for example. I see a lot of tendon problems, tendinopathy. We see a lot of arthritis, osteoarthritis. I see a good amount of entrapment neuropathies too. These are pinched nerves. And so kind of a lot of different things. And where I would say that my skill set comes to help out the rest of the team quite a bit is my use of ultrasound. So this is diagnostic ultrasound, where you might be familiar with using the ultrasound looking at babies. We'll use the same technology, pretty much similar techniques looking at musculoskeletal structures, nerves, things like that, to get pictures to get us some diagnosis, but also to help guide treatments. With the ultrasound, it allows us to be able to guide, say, something like a small needle into places that previously were not very easily accessible. So we can actually, procedures have developed that allow us to intervene minimally invasively, not surgically, for a number of problems where we really didn't have many options before. So that's a little bit about my day to day. But happy to answer more questions and talk more about it.
Yeah, of course. You said a lot of great stuff there. And what's cool too for a lot of people listen to this, I know something that oftentimes jumps out and things I know from the rehab side that I hear sometimes is if we say, hey, you know what, why don't you, I think you should see Dr. Ho in this case or another physician. A lot of times the assumption automatically is, oh no, that means I need surgery. And well, of course that happens. As you mentioned, that you offer a lot of other things. So that's a nice thing to hear because I think a lot of people think it's either like rehab on our side here, or if that doesn't work, it's automatically surgery, knowing that, hey, there's some of these things that are maybe are a little bit newer to some folks that are options out there. So that's really cool to to hear you talk about that. And one of the ones obviously you mentioned is just the ability to diagnose differently using something like an ultrasound. Do you find that oftentimes that replaces like more traditional X-rays, MRIs, and things like that?
Absolutely. I think I've seen this happen in a couple different scenarios. One is it can be a replacement and stand-in, but it can also complement too. I think there's a lot of overlap, but there's also some differences as well. So, every test that we have, every technology we have, I mean, frankly, every treatment we have has limitations, and everything has their own blind spots. Is sort of the analogy I'll use. Even an MRI has a blind spot. And there are some things where an ultrasound actually is in the right hands would be superior to an MRI for assessing a particular problem. Rotator cuff is actually one of them. As good as MRIs are, when you compare head to head, a well done ultrasound actually is superior to an MRI for rotator cuff problems. Well, conversely, for labral issues, an MRI is still the go-to. So there are some places where actually ultrasound and other technology like an MRI can actually complement each other, not necessarily compete. But where I do find it as a replacement would be, say, some people just can't get an MRI. I've had patients whether they have a pacemaker or some other implanted device that disqualifies them from going into an MRI, or maybe they had done an MRI, but maybe due to their ability to tolerate the confined space of an MRI, there was some extra movement, or the test didn't tell the surgeon what or the other doctors what information they needed. And so sometimes an ultrasound can be used to kind of complement, but also kind of overlap with some of the information there. So yeah, definitely see that as replacing a lot of the studies there. But ultrasound has its blind spots too. And I think it's important to recognize that and know where it fits in the full toolbox.
That's cool because that's really cool. I appreciate you sharing that because if I'm a patient and I'm coming in, that sounds like a great option to me because I can come see you if I say I did something silly over the weekend, I may have hurt myself, or I've had something going on for quite some time, and I'm just like, look, I finally need some answers. I can come see you and right, you can bring, and again, for those of you who haven't seen this, you can kind of wheel like a cart in there, and it's just on that. So it's not like you have to get a referral to an imaging center and go through all that whole process or in-house. It's just right in the room that you're probably seeing Dr. Hohen. And that's pretty cool because you get some answers in real time as well. And it just fills in another gap, like you said, that maybe X-rays, MRIs can't pick up. And so everybody can get a more holistic sort of view of things. I think that's really, really cool. And for, let's say, that person that's coming in, I'm just curious, because you see, like, you're so interesting because you see so many different things, right? But that's one of the cool parts I got to imagine of, and again, correct me if I'm wrong here, it's got to be one of the cool parts about being somebody who's specializing in surgery because it allows you to see a wider array of joints and areas of the body and stuff like that too, no? So,
Yeah, no, absolutely. And I might add that, I think, as time goes on, even if there's an, area, I think the reason why I kind of started to take care of from head to toe is, one of my old mentors used to say is that you're a product of your patients. And that's true over time. I think just approaching patients with whatever they need. And, if there's something I wasn't as read up on, certainly would get them to the right place, but I would take that as an opportunity to learn about that problem and then add that to my toolbox. And so I think at the end of the day, it just comes down to meeting the patient where they are, hearing about their problems, and then actually not just educating them, but also being educated by them, by their case, by their story. And so, and this is something I know you guys do a lot at Cohen Human Performance and PT. So definitely, obviously, your group and my group have had a great synergistic relationship because of that mutually agreeable philosophy. So that's been great.
yeah, your group, in fact, has we won't call anybody out, but has even seen a few of us as patients recently. So, um, but we'll leave that there. So as far as obviously the two main populations we work with are, your adult athletes, let's call it, and your youth athletes. So, amongst those two different populations, are there more injuries that are more common that you see amongst more of like your youth, high school kids, let's say, versus, your 40s, weekend warrior type who just likes to be able to get after it, whether it be in, the gym or, basketball or whatever the case may be.
Absolutely, absolutely. We do see some patterns. A lot of it has to do with the differences in the growing skeleton versus the mature skeleton, and also different activities that are chosen too. Like pickleball is really big now, so we're starting to see a lot of pickleball injuries. So definitely the patterns do emerge and they evolve over time too. But like for example, we'll see a lot of degenerative wear and tear conditions in our adult athletes. So these are a combination of the natural wear and tear that happens to tissues like tendons and even joints, combined with the chosen activities that a patient might decide to adopt. And that combination chooses or manifests itself with certain injuries like rotator cuff problems, tendinopathies or tendinoses. So these are wear and tear degenerative conditions of tendons versus in kids, we'll see a lot more growth plate injuries. We'll see what we call traction apophysitis. This is basically kind of an irritation or inflammation of growth centers where tendons attach to bones because the growth centers are still growing. And so there's a little area of potential vulnerability or weakness there from their chosen activities. And certainly, so we see patterns emerge from kids versus adults. But I will also say there is some overlap too, and I think that we're starting to see some adult injury patterns start to creep up in younger and younger athletes, and I think a lot of that is a product of different things. But we're pushing our young athletes to do a lot these days, and as fun as that is, I think sometimes building the opposite of that coin of that recovery becomes important too. And it's dealing with a lot of athletes, it's a challenge to be able to get the training and the competition in, but also the recovery in and the rehab and prehab in order to kind of keep problems at bay. It's a lot to juggle. And so sometimes if we don't hit that stride just right, you don't have enough recovery, we start to develop overuse injuries that start to take the shape of things that we used to see in adults more than in kids. And so we're starting to see a little bit of this overlap. But generally, yeah. So these are some of the things that I see a lot of.
That's so interesting. It's really interesting that you say that because, especially at the end when you mentioned a lot of like how, you have your injuries that are a little more classic and stereotypical of somebody who's middle-aged versus more like high school-ish. And now you're seeing sort of that merge come in a little bit, especially with the youth population getting things that you used to see more in adults, because we see a lot of that now too. And so I'm curious based on that. Do you have like based on you mentioned obviously the growth plates and impact that has for more your apophysitis kind of issues where like tendons attach to bones and all that type of stuff? Do you have a recommendation for like high school kids out there? I know male versus female can be slightly different on age, but on when they should maybe start thinking about, or when is it too soon, or when can they start maybe getting after it a little bit as far as like weight training and things like that go? Just curious
Yeah,
your thoughts.
absolutely. I guess you mean as far as when they could start to really start pouring the gas on the fire to build and
Yeah,
get.
we've had I mentioned because we've had a few incidents, and again, not to stereotype here, but a lot of times it's, the young boys that
Yeah.
sometimes are a little over eager to get into lifting the heavy weights, maybe a little too soon. And so I'm curious if you have any thoughts as like from an age and I know and or maybe development standpoint as to like, hey, if I want to participate in my high school football team's weight training program consisting of, heavy back squats and deadlifts and things like that. When is it safe to start doing that?
Absolutely. I think that's a great question. And there are a couple of concerns. People ask, well, what's the problem? What's the downside in adopting it too early, right? And the downside, of course, is injury. You worry about injury to the growth plates, you worry about maybe longer term effects on the growth plate. So basically it comes down to as far as what you do and how much you do when it comes to a weight training program, I usually suggest, well, is your body prepared to do that yet? Be able to tolerate that load without injury. And it really comes down to where you are during that development in the teenage years, as you start, as the growth plates start to mature and maybe even start to close. That also seems to correlate with certain hormonal changes that will actually also reflect and collaborate or correspond with changes in the muscle, where the muscle is now really ready to take and build that mass and increase the contractile units. So all that is fancy speak, but basically meaning that the body may not be ready to increase all that load. It does not mean you can't do anything. And in fact, I'm a big proponent of starting weight training early, but not necessarily putting on the ton amount of weight, because the first thing to keep in mind, I'll tell patients all the time, is that the majority of your strength gains, if your body isn't quite ready hormonally, is going to be in the term of the nerve innervation to the muscle. You're not actually building huge muscles. You get leaner, you'll get stronger, you might look a little more ripped, but you're not going to basically bulk up until your body's hormonally ready for it. So it's impossible to do it. So don't try to go for that, because you won't reach it and you'll just hurt yourself. So really come down to technique is really important, because that is something that we often can always use more of. So technique, working on a variety of techniques, really learning the how to of the weightlifting. And then once your body's ready hormonally, then you can start adding on the actual load. It's not just the how to, but the how much. And so as far as when that is, it varies from person to person. And say for a younger female athlete, I might suggest it a little earlier than say a male athlete, mainly because of the hormonal differences there. Uh, and so really you're focusing a lot on technique, say for a male athlete, mostly on technique. Maybe you can play with the load, but be mindful not to overload it until you're about 14, 15. You can start then play with the load a little bit as the testosterone surge starts to begin. And so this discussion I have with young athletes and their parents become a lot of discussion about puberty and development as a teenager and a young athlete. But yeah, so it depends. But I would say kind of around that time frame when early high school, and this is probably why you see a lot of high schools develop weight training programs, and you don't see it as much as say the younger elementary schools.
Love that. That's super helpful. That perspective's fantastic. And you're right. Of course, that's one component of it. And it's also making sure we're balancing all the other stuff that is on a schedule, keeping it within reason. So we're just not overloading with volume overall, because I'm sure, as everybody here can attest to, kids these days, there's a lot of them they're playing lots of different stuff at once. And there's a million different teams even in the same sport. So, making sure we're dosing things properly is always a challenge. So, we mentioned, we touched on the kids a little bit. What about like adults? Is there something in like the adult population of what you see, obviously with classic conditions that they might be dealing with, whether it be chronic tendinopathies or arthritis or anything like that, that you maybe wish that the adult active population knew about, because or if you're
Mm.
noticing any trends or anything like that? Would love to hear things that you've seen, or maybe if there's like advice that you find yourself constantly repeating. I'd love to hear if there's anything like that.
I think that's a good point, and I think that it really comes down to what a little tagline that one of my former mentors had told me, and that was, "Get in shape to play the sport. Don't play the sport to get in shape." And of course, and I think that's an important thing to think about. But it goes beyond just the traditional hit in the gym. I think that. One thing I often wish that more patients knew was you have to, if you're going to be active and continue to be active, especially at a higher level, or if you're transitioning from a low level and just adopting things, you got to prepare your body in order to do that activity so you don't hurt yourself. And some of that requires a little bit of maintenance at home or a self-care program. And this is where, working with a skilled therapist, like somebody from your team, to build something like that can be helpful. And I find myself giving this advice all the time to patients. It's like, okay, you need to build something so you can work on at home, because and yes, sometimes they'll say, I feel good when I foam roll, or I use the lacrosse ball to release some muscles, but it doesn't last very long. I said, well, if you only do it once or twice, yeah, you're only going to get a temporary relief, but you have to build a habit into it and over time that will translate into less pain, more flexibility, and frankly better performance in whatever activity you want to do. So I would say that as far as the conditions that I see a lot of there's definitely a dimension of it where patients just aren't preparing their bodies, they aren't doing the homework at home in order to make it so they can enjoy the activity as fully. And so really comes down to, it takes a little investment in time, a little bit of, build it into your me time at home and help condition your body a bit. And the little massage balls and the foam rolling is a big part of that. So yeah, so that's, I would say in generality, it's probably a big thing that I see that I wish more patients know, and I give that advice pretty much all day, every day.
Love that. I love that. And I think it's a really good thought, really good advice, really good way of thinking about it, because it's funny. I find myself repeating a lot of the same things to my patients where it's like, and a lot of them will kind of say that, oh, I'm getting older, so injuries like this or certain things are inevitable, right? And my response is always never to be argumentative, but always saying, well, maybe not necessarily, because it's because not that just that you're older, things are going to happen. It's just that, hey, you know what, more things that with life stack up on itself. So I'm sure your lifestyle is a little different than when you were a teenager. You're probably sitting at a desk a little bit more, or stressed from work or other things where it's harder to dedicate the time necessary to, do the things to maybe counter the amount of lifestyle sedentary stuff or whatever may be out there that you're doing. So then if you're going from kind of like 0 to 60 of being at work all day to then being able to go play in your men's league basketball team on the weekends, that's a big transition. And so like you said, I've heard this with running a lot. Instead of being running to be fit, let's make sure we're fit to run. And
Absolutely.
I think that's a really good point of making. So final question I really have here for you today is, you're involved with a lot of new, exciting stuff in the world of medicine, in the grand scheme of things. I'm sure you would agree, like a lot of regenerative medicine and things like that is very new and exciting. So what kinds of things in your world, I guess, are you diving into is exciting you these days in terms of like, benefits and that we're seeing out there that and how patients are benefiting that maybe they may not know about?
Absolutely, absolutely. And I think so one thing that you mentioned was regenerative medicine. And that's kind of a new old thing, I would say. And the interest in using our own body in order to kind of intervene and get the body to heal, and capturing that potential, and maybe potentiating that potential has always been there in medicine. Uh, I've been doing regenerative medicine, which is the old term. Orthobiologics would be the new term, since, gosh, 2008. So it's been a long time. So it's not necessarily new, but it has seen continual evolution and moved from something that was just a cool idea and on the fringe or the cutting edge to being something that's firmly placed now in our toolbox. And frankly, I think a lot of patients and doctors are starting to see these orthobiologics like platelet-rich plasma or PRP as something that's actually part of the norm in medicine now. And so I would say that's exciting because it has continued to evolve, and the potential, the promise that we were hoping when we first started doing it is actually finally starting to be realized. So this is things like, I'll use platelet-rich plasma or PRP as an example. That's where we take a sample of a patient's blood, concentrate platelets and the component of the blood that's key in wound healing, and then use a procedure under ultrasound and inject it into a tissue in order to trigger or ignite the wound healing response, but inside of a tendon where healing hasn't really occurred, where it should have occurred. And I think it's a fun thing because we're getting way more precise about it and more customized per patient. So I use what we call modern PRP now as opposed to classic PRP. But I would say regenerative medicine, orthobiologics has really started to move out from its infancy through its adolescence, and it's really matured quite well, where it has a real strong place for a number of conditions in sports medicine. And I think that's also, since, talking to the physical therapist, it's an important thing because I think that, this is where what I do in orthobiologics and regenerative medicine pairs really well from a, kind of on a in a teamwork sort of approach, because we're really thinking biologically what we're doing for a diseased tissue in a patient, and that includes other stimuli to affect the biology of that tissue, like mechanotransduction in therapy and exercise. And I often have to educate patients that that's not just exercise for exercise sake. We are actually doing something biological to the tendon, just like I am with the PRP. We're just doing it different ways and together synergistically getting you to heal. So I think that that's kind of customized medicine in sports and exercise. I think is an exciting field that continues to see development and evolution.
Yeah, that's so cool. I appreciate you sharing that. And it so much of it comes down to, like you said, and that's kind of where this interview series sort of stemmed from, was just highlighting that collaboration that ideally is part of medicine, right? I mean, I know you mentioned PRP a second ago and platelet-rich plasma, and I remember the first time hearing about that was like back in the early 2000s. I think it was Kobe Bryant was
Yeah,
at it, and I was like, what is this? And you're seeing it kind of migrate from that sort of world to now being able to happen for all of us is really cool. And just like with those pro athletes, can we have a team around them to all work together to just get them the best result and what and that they're looking for? So man, this is really cool, Dr. Ho. I really appreciate your time here today. By the way, for anybody watching this, below the video here is going to be Dr. Ho's contact information, so you can find them. But Dr. Ho, is there a way that you prefer people to reach out to you if they could use your help in any way?
absolutely. Thanks for that. So Ortho Virginia has done a really nice job of creating a kind of a good online presence for us. And so if you go to the Ortho Virginia's practice website, you can search for me. I've got my own page on the Ortho Virginia website, and they've also built my own personal page, which has got some videos that I've made as well. There's some rehab handouts as well. And some education handouts, and it's just a little bit about me, a little bit about my background. I've got a big background in education as well, and so happy to be part of the team. Happy to help out how we can, and I love collaborating. I love teamwork, so this has always been fun. Thanks.
Absolutely, my pleasure. And again, just take a look below the video. You'll have the links to all that great stuff. Highly recommend Dr. Ho for anybody watching it. I know our team here in McLean, being that he's in Virginia, we've referred several different patients his way that had great experiences. And we've had some folks traveling from Bethesda and our facility there too as well. And so again, couldn't recommend them well enough. They've been a great help to us. And most importantly, Dr. Ho, really appreciate your time today and joining us for this.
Thanks a lot. Appreciate it. And, great to see you, Zach.
You too.